Hello everyone and welcome to our Monday Minute. We're here today to discuss the Home Health Quality Reporting Program compliance that is required in order to avoid a 2% reduction in payments in future years. CMS released recently the notification that if you received a letter stating that you were non-compliant with the Home Health Quality Reporting Program requirements, you would receive a 2% reduction in payment in next year's calendar year and fiscal year for home health. They also said in this memo that you have until November 13th of 2023 to submit a request for reconsideration via email if you feel that the letter contained incorrect data and that you were found to be compliant with the Home Health Quality Reporting Program requirements. These requirements are very misunderstood in some cases. There are two components that specifically go into the determination as to whether you were found compliant for the 2% reduction calculation. The first is that you are fully compliant with the Home Health CAHPS survey requirements and that your vendor has submitted all of your data as it is required to be submitted timely. In addition, the most misunderstood portion of this situation is the OASIS data. There is a specific calculation that requires 90% of your OASIS transmissions to be considered quality assessments. The definition of a quality assessment means that the OASIS fits within a quality episode of care. The quality episodes are calculated based on start of care to transfer or discharge and resumption of care to transfer or discharge. So when they are making this calculation for purposes of determining you to be in compliance with this calculation, they are looking at all of the OASIS you have transmitted and ensuring that at least 90% of them fit within a quality episode. And so what would be considered an OASIS not in a quality episode? So if you had 50 patients, and obviously that's a small sample, but if you had 50 patients and 30 of those patients had a brand new start of care OASIS submitted during the time period that they were making the calculation, and those patients never had another OASIS submitted, those starts of care assessments would count against you in the calculation of whether the assessments fit into a quality episode of care. If there was a following transfer or discharge, then those would be considered in a compliant quality situation. If you have resumptions of care and no subsequent OASIS, those resumptions of care would count against you in this calculation. Also keep in mind that if you do have a start of care and then you continue to have recertification, as long as you are submitting those recertification OASIS, that start of care would still be considered to be in compliance. So it becomes non-compliant when you've submitted only the start of care and nothing else, or you have submitted maybe a couple of recerts, but then nothing else. There has to eventually be an end point. And if there is a gap where recertifications are not being submitted and there's no transfer or discharge, then there will be a negative impact of those assessments on this calculation. We are going to provide you a link to the details of this calculation. If you have any follow-up questions regarding compliance of the Home Health Quality Reporting Program, please don't hesitate to reach out to Healthcare Provider Solutions. We are here to assist. Have a fabulous week.